Often just the location of hip pain and a quick description is enough to figure out what's causing your pain, so let's have a look at the most common hip issues. Hip pain can be experienced at the front, side or back of the hip. I'll start by explaining the issues that tend to give us pain at the front. If your pain runs down the front of your hip here, and it hurts to lift up your knee, especially against resistance, you might only have a strain of one of your hip flexor muscles that lift your knee up. You can test these muscles by lying on your back on a firm surface and pulling the opposite knee as high as you can. If this causes pain in your sore hip or makes the leg of the sore hip lift off the ground like this, then it's likely that you have tight, strained hip flexor muscles. Gentle, progressive strengthening exercises with a physiotherapist will usually be all you need. If your hip pain is at the crease of your leg, and worse when you bend, lift, cough, or bear down like you're going to the toilet, it's more likely to be a hernia, especially if there's a slight bulge under the skin in this area that's worse when you stand or cough, but the bulge reduces when you lie down. See your doctor if this sounds like you. If the pain is a little higher, but it's harder to pinpoint its exact location, there's no lump, and coughing or sneezing doesn't affect it, it could be referred pain from your lower back or pelvic joints. This is surprisingly common, so if your low back or pelvic joints at the back hurt a bit too, you probably need to see a chiropractor. Now, if you get a sharp pinching pain deep in the hip joint when you bend your knee past about 90 degrees, that means you're dealing with something right in the hip socket itself. Pulling your knee towards your chest compresses structures within the ball and cup joint of your hip. Turning your knee in a bit and bringing your foot out will usually make this pain worse. The following things cause hip socket pain when you bend your knee right up, and will need an X-ray or a scan to confirm the diagnosis. If you're younger, say 15 to 45 years old, it could be impingement. This is where the bone of the ball or cup of your hip joint protrudes a bit, making the bones rub together, causing a pinching at the front of your hip. If you notice clicking or catching, giving way, perhaps with some stiffness in your hip, you may have damaged the ring of cartilage around your hip called the labrum. This can happen at any age, especially if you have the impingement that I just described. But if you're over 50, the pain has been getting progressively worse over years, and your hip feels stiff first thing in the morning or after periods of inactivity, you could be developing hip arthritis. With arthritis, the more you exercise, the worse it feels, and sitting down is a relief. But if you sit down for too long, your hip will be stiff getting up again. Bending your hip fully gets progressively harder with osteoarthritis, so a classic sign is trouble bending forward to put your socks on when you're sitting. You'll feel like you need to push your knee out to the side to reach your foot. Other rarer possibilities for hip socket pain at the front include hip dysplasia, which is where you're born with a shallow hip socket which degenerates over time and finally catches up with you as you age, or necrosis, where the delicate blood supply to the hip gets damaged, causing some of the bone in the ball of your hip to wither away. X-rays and scans will help to figure out which of these hip joint issues you have. Now, if your hip pain is on the outside of your pelvis, right over the bony lump of your hip bone, or in the muscle just above or behind there, you're invariably dealing with tendinitis of the outer gluteal muscles. This can happen after a recent increase in exercise or activity, especially in people over 40. It's 2 to 4 times more common in women because of their wider pelvis, and it can often be sore to lie on that hip in bed or press over the bone. MRI results can give a false positive for this problem, so the best way to confirm that it's tendinitis is to stand on the leg of the painful hip with your pelvis level for 30 seconds and see if this reproduces your pain. Weak outer gluteal muscles is the underlying cause of the majority of outer hip pain, so strengthening these muscles will usually fix the problem. I have a couple of videos on how to do this, so I'll leave a link to them below. Now, if you notice that your hip snaps or flicks as you walk or move though, The iliotibial band running down the outside of your thigh might be rubbing on your hip, so I'll leave a link to a video that shows you how to release tension in that band. Now, if your pain is at the back of your hip, it feels like a deep ache in the glutes, tends to hurt with prolonged sitting or sport, and it hurts to press here or stretch your gluteal muscles like this, you're suffering from PIRIFORMIS syndrome, a contracted muscle right behind your hip. It can often refer pain, numbness, or pins and needles down the back of the leg too. I'll put a link to a video on how to fix that below too. In comparison, hip pain from irritated low back joints often causes pain in the low back region as well, and tends to be painful with back movements like getting up from a chair, bending, or reaching forward to put on your shoes. Now, if you feel a distinct pinching right here when you take long strides during walking, but taking smaller steps tends to feel better, then you're getting impingement between your leg bone and your pelvis. But if it pinches a little bit higher up here, then it's impingement in the back of your actual hip socket. You can test this by lying on the end of a bed. If you pull your opposite knee towards your chest and it pinches at the back when you drop the leg of your painful hip down, out a bit and turned out, that's hip socket impingement or a labral tear at the back. And finally, if your pain is right on the bony part of your pelvis that you sit on, you have a strain of your hamstring tendon where it attaches onto your pelvis, so you'll need to do some progressive strengthening of your hamstring muscle. The most common underlying issue for hip pain is weakness of the outer gluteal muscles. So to see how to strengthen those muscles, watch this video next. The other links I mentioned are in the description box below.